drug abuse versus drug dependence. Luna asks, hey Luna, what kind of terminology might you find in a patient's record that would indicate abuse versus dependence? So I had to do my little Google research. And for those that this is the first time on the call, the ongoing joke out there, especially in Facebook land, is that, I always say, Google it. And my niece told me that, she goes, that's why you're going to raise your kids, aren't you? You're going to tell them Google it first. Yep. And it's amazing what you can find. So don't be afraid to use Google for medical coding research. Just type it in and you'll be amazed at what you'll find. And that's how I found this. I'll go down to the footnote so you can see where this came from first. It came from the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, DSM-IV. That's an official manual that's used. We don't code from it, but it gives us the definitions that we do use for coding. And before I go on, I just want to say, as far as, what indicates abuse versus dependence, the physician should really be documenting one of those two words. You shouldn't necessarily, you shouldn't have to piece it together, but to understand, what's behind the difference. Here we go. Substance abuse is defined as maladaptive pattern of substance use leading to clinically significant impairment or distress. Now that's pretty much the same for abuse versus dependence. Now here's where the differences come. They're going to have one or more of the following occurring within a 12-month period. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. The second bullet, recurrent substance use in situations in which it's physically hazardous. Recurrent substance-related legal problems. Continued substance use despite having persistent or recurrent social or interpersonal problems. And they have a note here that the symptoms for abuse have never met the criteria for dependence. So if they've ever met the criteria for dependence, then that's what you should use. Now, according to this DSM-IV, a person can be abusing a substance or dependent on a substance, but not both at the same time. And that makes sense. So here's the definition for dependence. So everything was the same, and they're going to have 3 or more of the following. Tolerance, as defined by either of the following: a need for markedly increased amounts of the substance to achieve intoxication or the desired result. Withdrawal, they would go through with withdrawal if the substance was removed. The next bullet, the substance is often taken in larger amounts or over a longer period than intended. There is a persistent desire or unsuccessful efforts to cut down or control it. And then a great deal of time is spent in activities necessary to obtain the substance, use it, or recover from it. Important social, occupational, or recreational activities are given up or reduced because of it. And the substance use is continued despite knowledge of having a persistent physical or psychological problem, like cocaine use, having that cocaine-induced depression, or liver problems. So that is the difference officially between abuse and dependence. So dependence, 3 or more of those bullets, and the abuse was 1 or more of these bullets. Okay, so this will be on the answer sheet, but again, if you just Google substance abuse versus dependence, you will find pages like this. And again, coding-wise, we really want the physician to tell us, is it, drug abuse or drug dependence.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.